right, so as we just heard, important to know the signs of vascular disease and to get checked out. So to talk more about what we need to know, how to spot warning signs, when to seek help and reduce our risks, we're talking with Dr. Tyler Buckley with Cone Health Vascular and Vein Specialist. All right, let's just start with the basics so everyone kind of gets it. What do vascular conditions like narrowed arteries or coronary artery disease mean for someone's health?
So narrowed arteries and arterial disease can cause significant problems for someone's health. Essentially, just so we're all on the same page, arterial disease is basically a buildup of plaque in arteries, and depending on where that plaque is can cause different problems. I like that you mentioned coronary artery disease because that is the most commonplace, but we also can get buildup of plaque in the carotid arteries as well as the leg arteries.
Okay, and so because of that, a lot of people right now are thinking about themselves, okay, that's a lot of like medical speak, that kind of thing. So let's just even bring it down. What are some most common warning signs that folks should be watching for?
Unfortunately, when it comes to arterial disease, there's not that many warning signs before pretty significant symptoms can occur. It all depends on the vascular bed that the plaque is in. So for example, in the coronary arteries, which is what our cardiologists treat, people can develop chest pain when walking, shortness of breath when going up a flight of stairs. But when it comes to arterial beds such as the carotid arteries that bring blood flow to our brain, or the leg arteries, you really don't notice anything until you start having symptoms.
Okay, and are there some symptoms? Let's talk about the symptoms we absolutely need to be watching out for, and then maybe some ones that are kind of subtle that we may just be passing off.
Absolutely. So in the carotid arteries, there's really no symptoms before it is dangerous, meaning this is relatively asymptomatic until someone has a stroke or a mini stroke. In the leg arteries, you can start having some leg pain when walking, you can start having some foot pain, and if it gets really bad and we don't catch it early enough, you can actually end up with wounds which lead to an amputation.
Okay, so we want to back up even more because we want to think to ourselves, all right, when does someone need to pick up the phone, call their doctor and say, hey, I think something may be going on?
Definitely when they're starting to have foot pain when walking or calf pain when walking. In the carotid arteries, like I said, there's not much room for catching it early other than screening. And we have different screening tools that help us. And your PCP should know your medical history and know if you would qualify for a screening, which is just an ultrasound. But in the periphery, you should definitely, seek further vascular care if you're having foot pain or leg pain when you're walking. That's usually the first sign.
Okay, and you mentioned that with the screenings that an ultrasound would be something for someone who maybe has never had one of those. What does that entail?
So typically if you come into our office and you're complaining of leg pain or calf pain when walking, the first test is just called an ABI, or an ankle brachial index, which just means we're putting some blood pressure cuffs on your ankles, some blood pressure cuffs on your toes, and we're assessing what kind of perfusion you have down into your feet.
Okay, and then the ultrasound would also be a different kind of screening?
So that's just a further, another test that can further give us some information about the blood flow in the legs.
Okay.
That's also the screening that we do for the carotids as well as an ultrasound of the neck.
Gotcha. And that doesn't start with you probably, it does start with our primary physician to kind of feel that out first?
Correct, yeah. So it would start with your primary care doctor who would evaluate exactly what symptoms you might be having, as well as your medical history to see if you might need a carotid ultrasound or a screening. And they'll order the test and then send you to us.
Okay. All right. So when we come back, we're going to continue this discussion. We're going to talk about what happens if it goes untreated, what you need to know, what kind of things you need to be looking at in your past medical history and things of that nature. We'll be back in just a few minutes.